Rogers Anderson, Williamson County's mayor, and today not only do I have an individual to talk to that I greatly admire, but an individual that's just done a marvelous job here in Williamson County, really in her career throughout the state of Tennessee. And Becky Brumley is in charge of our public health department. And thank you for being with us today.
Thank you. It's nice to be here.
You know, people that watch this show, oftentimes they may know my face, they may know your face. You go to Publix and Kroger's and the different grocery stores in our area, but they want to know a little bit more about Becky. Who is she? Where'd you go to school? How'd you get involved in public health?
Oh me, I grew up next door to a doctor who was in private practice for a long time, and then later in his career went into public health. And I was always fascinated when he came home with the stories that happened to him at work. And so I migrated toward public health as soon as I got out of college. I went to UT Martin for a couple of years, and then actually went into dental hygiene. Went to UT Memphis into dental hygiene school. And then as soon as I got out, I had a phone call, just out of the blue, from Dr. Robert Ingram, who is the dental director for the health department in Jackson, and said, would you like to come interview for a position? We've got a hygienist that's leaving and we need a replacement. And so I went and interviewed for that position and worked in the clinic for a little while, and then had the opportunity to go into more of a preventive mode. I worked with the schools in Northwest region and north of Jackson, and went into schools, did dental education, did supplemental fluoride programs, a lot, in those days, a few years ago, there was not a lot of fluoride in the water. And so we had a lot of children who were suffering from dental caries that we could prevent by having fluoride treatments and available in the school setting. So did that for a few years. Actually transferred to Knoxville, and again with the dental program. Just happened to walk in one day, and the lady that was doing the same job I was doing had put in her resignation papers on Friday, and I walked in on Monday. So just a good luck, thing of fate, or just a plan. And we worked there, decided to go back to school and get my master's because I was right there at UT. And if you know anything about the state system, we get one class a semester, our fees waived. So it was a nice way for me to do that and take advantage of the benefits that the state offer. After I got through with my master's, I just happened to be working on a oral health needs assessment, and the department came along with a new initiative of assessment and planning for communities. And my regional director looked at me and said, well, you've done assessments, you can do this. And so he put me in the position of working in communities to look at the needs of communities, looking at data. We did what we call community diagnosis, where we gathered tons of data together on that particular community and had the people in that community look at that data and decide what the priorities should be for health. And then the health department helped them make plans and create initiatives to, as our current commissioners, to move the needles, to make our community a healthier place and our citizens in the community healthier. And it takes a targeted effort to do that. So I did that for several years in the East Tennessee area, and then was recruited to come to Nashville with my husband, who also works for the state, and work downtown with the community development program, doing the same thing, but kind of overseeing that program for the state, along with some other federal grants that they had, primary care, rural health, health access. So did that for a few years, and then had the opportunity to come and work in the community in which I live, which is just what I wanted to do all along, but it just hadn't worked out. I'd always helped other communities, but never been able to actually work and make a difference in the community that I lived in. So I've been at the health department almost 9 years.
Well, we're not going to go into the next phase of your life other than to say that you will be retiring. That announcement has been made. You've got a very short window in which to continue to be our director. But we wish you a lot of success. We won't call you a traitor, as I've said before. You will be greatly missed. You have made a difference in your community.
Thank you.
And you will be just as successful in your next venture. But before you do that, we've got to also talk about public health here in Williamson County and what a difference the last few years have made in public health. But the question you have to ask is, why do we need public health in Williamson County? We've got physicians and a wonderful hospital, medical center, Williamson Medical Center works very closely with our public health department here in helping to offset some of those costs that you just normally and traditionally would not see in other parts of our state. But looking at public health, say from a 30,000-foot level, Becky, and looking down on it, why the need for public health?
Well, public health is so different than health care. When you look at public health, it's, those public health workers are there to protect you. They're there to make sure that your food is safe, that your children are immunized, that you get the start that you need for children who are at a disadvantage through the WIC program. So they're those underlying things that keep you safe and keep you healthy. When you go to a restaurant, you rarely think that our general environmentalists have been and inspect that restaurant every 6 months to make sure that what they're doing is appropriate, and that when you go to eat there that food is safe. The immunizations that we do, we've expanded our immunization program so that immunizations is a moving target, because there's always coming out with new things and new combinations. They do a lot of combination of immunizations now. And so we've been fortunate because the legislature has made it available so that we can actually offer more immunizations to more people. Used to, we were limited on who we could give it to because most of our vaccines came from the Vaccine for Children program, but we've been able to expand and offer those vaccines at and do that, most of them on a sliding fee scale where it's based on family size and income.
When you think of public health, and we do have to think of it on a day-by-day basis, we've had issues throughout our country, throughout the world, where a particular disease may rear its ugly head in one area, and because we are so transient, because we can be in another country in just a matter of hours, certainly a day, you can bring that particular disease back. I remember as a small boy in my school, taking the sugar cubes to help stamp out polio. Mm-hmm. And for many years, you just didn't hear about polio. And I think people that watch this show might understand that in the importance of public health, but it's probably been a long time since we've had a case of polio in the United States, or to my knowledge, but it does stick its ugly head up from time to time. And one of the and it can cripple a nation. It can bring us to our knees very quickly, some of these common diseases. We all know the advantages and the encouragement about having flu shots. Now, there's a certain group of people that will not get flu shots. There's a certain group of people that wouldn't miss it for all the tea in China, as my mother used to say. But the fact of the public health is here for our citizens. It is not a primary care facility to take away from your primary doctor.
No, we're here. One of the new things that we're doing is with our new commissioner, he is very focused on prevention. He wants us to really go back to that primary prevention so that we can make a difference with diseases before they ever start. You know, the obesity is rampant in the United States as well as other countries. And the only way we're going to do that is to go back and start with very, very young children and help them understand the importance of exercise and diet. So we're able to, through our primary prevention initiatives, the staff at the health department went through some strategic planning and came up with some targets that they wanted to work on. One was obesity, and one of the things that we're doing, and this kind of goes along with something we're doing with the county too, is community gardens. Teaching children how to grow their own vegetables, teaching them how to plant a seed and watch that tomato plant grow, and then being able to pick that tomato and have it on their salad for lunch. We have a rather intense project at Franklin Special School District with their MAC morning and aftercare program, and one of our health educators, Kathy Montgomery, has partnered with Sandy Heim with the MAC program and the farmers market, and they have revised or revitalized some raised beds that were over at the school where MAC does their summer program, and they've gotten so excited. Now they've plowed up the side yard, and they're planting corn, but the kids have been able to take the seeds and plant them, watch them grow, transplant them into raised beds, and then watch them grow, water them, pick them. The farmers market has done a fabulous job. They come once a week and they do a lesson on something related to gardening. They've been able to play with worms and understand what a worm does and why we need worms in our garden. So that has been just a huge success. We're hoping to expand that. We received a small grant from the department, from Minority Health Grant, to expand those gardens and do the same thing at another school.
Well, it is important. Of course, I grew up in a time, and I know I'm from East Tennessee, you're from West Tennessee. Having a garden at your home was just a way of life. Probably number one reason was to save money from mom and dad having to go to the local store. But you raised a garden. You cured that garden. You weeded that garden.
That's why you use weed block.
That's right. You learned how to use pesticides that were not harmful. We didn't have them back in those days to the degree that would cause a lot of damage to your body and to the product, because that was your meal. Sometime later into the fall and winter months. It was nothing uncommon during the summertime for us as children, along with the parents, to have a bonding time. Parents talk about that, of breaking beans, shelling peas, picking corn, working if you were fortunate enough to have an orchard. We did. We had apples. So most everything we had. And you learn that from a young age, from a very, very young age, that was part of the process of a family that they had to do. Fast forward 20 years, 30 years, 40 years, smaller lots, smaller communities, faster growing communities, and you've kind of gotten away from that. One of the things I can't help but reflect on it in our Williamson County Fair that was in its 9th year is to emphasize the ag side of that, not just the livestock and the chickens and the goats, but also the product that Lee Sanders does a wonderful job of having blue ribbon for the best cucumber or the tomato. I mean, it's all, gardening can be fun, but there's an ultimate purpose about it, is to have a healthier lifestyle. You touched on something a minute ago that is critical, I think, to every community, and that's education of your community towards different events. You were making reference to the Franklin Special School District and what you're doing over there. We have 2 facilities here in Williamson County. have one next to the administrative complex where you get your car tax.
Mm-hmm.
You have another location over in the Fairview area that serves that community as far away as Hickman and Dixon County. When we look at people coming to our public health department, it's not just about dietary needs. It's young women that are pregnant needing services that they may or could not afford, or just in the side of education. It is also more than just going in and getting a pamphlet, but oftentimes we do deliver a lot of services to our people in Williamson County, not only health-wise, but in your primary vocation in life in the dental side we offer.
Mm-hmm. Mm-hmm. We have a brand new dentist at the health department. He's been here since January, so I guess he's not too new, but he has been a huge asset to our health department. He comes to us from Connecticut and has at least 10 years of experience in private practice. So he has just done a great job with the children and with adults who need emergency care, and everybody just loves him. He's real tall. So the kids all talk about the tall dentist. So.
Can anyone come through the doors, or is it income-based for services?
For primary care, we primarily focus on uninsured, people without insurance, and those people who have TennCare. But for the other services that we have, family planning, the WIC services, immunizations, communicable disease, all of those are if there is a charge, they are based on family size and income. So we have more services that are offered to everyone than we do that are limited. Some of the programs are limited, like WIC and CSS. You
need to tell what those are. You're not allowed.
I'm sorry.
You're not allowed to use initials on this show.
WIC is Women, Infants, and Children, and that's the program that provides nutritious food to pregnant women, vouchers for pregnant women and young children, and formula for those who need it. And the Children's Special Services, or what I refer to as CSS, is a special program that we have for children and youth with special needs. Sometimes there are services that they may have insurance, but they may have services that they need that are not covered by insurance. So the CSS program helps them with some of those services. It may help them with their copays to go to the doctor if they have a copay. And some of those services that those children need are very expensive, and they often need a lot of services. An example for I don't know of any health insurance that covers a hearing aid for a child that has a hearing loss. And the CSS program helps to provide those types of things. And it is based on income, so you have to meet the qualifications for that program. Also for the WIC program, there are income guidelines. We also have a breast and cervical cancer program that helps women with mammograms that may not be able to afford them, that don't have insurance. Again, there's an income level that you have to meet to qualify for that program. But for those women who may have a mammogram and have something come back that needs further investigation or further testing, then that program helps them with those types of services.
Becky, when you look at Williamson County, and it's a very fast-growing community, one of the fastest growing in population across the state of Tennessee. And our two locations, one here in the zip code of 37064, and then the other one over in the Fairview area, I would surmise that we get very little activity from Spring Hill, Thompson Station, or Brentwood.
No, we get, there are a lot of services like the immunizations and birth and death certificates. We do a tremendous amount of issuing birth certificates and death certificates in the Franklin office. We do not have that service available in Fairview yet. We hope to get it, but you'd be surprised how many people need a birth certificate. If you're going to get your driver's license, if you're going to
join a sports team, you're going to have
you're
that.
going to have it. So we do a lot of those things. So we get people from all over the county. We get and immunizations too. There are private providers who have immunizations, but a lot of them, because immunizations you have to be so careful about refrigeration and monitoring temperatures, that sometimes it's not conducive to them to have all the vaccines that people may need. So we do a lot of immunizations. We have a lot of WIC participants who come from especially the Spring Hill Thompson Station area.
When you look out into your crystal ball over the next 3 to 5 years, how will public health have to be delivered in order to survive some of the cuts that are coming out of Washington? Without getting into the political side, I know you'd rather put that aside, but that is an issue that someone pays for these services, and it comes down from Washington to Nashville and Williamson County. If people did not know it, we provide employees. We pay for employees also over at the health department. This is not run strictly on federal and state dollars. Here in Williamson County, your tax dollars also go to help support the many programs that we have. Now, that's not true across the entire state of Tennessee. But health care is on the forefront of everyone's mind, regardless if you like or dislike the Affordable Health Care Act that's going through and being debated. But public health will still have to be delivered in some form. How do we do that?
Well, I think we can, we first of all can focus on what we do for that primary prevention. I think we've learned to multitask. Our staff now not only works in the clinic, but goes out into the community and works on our primary prevention programs. You just learn to do a lot more with less. That's what we've all done for the past few years. Right now we have the greatest staff at the health department, and they are so excited about being able to not just work at the health department, but also work in the community, work in the schools. We have there's a different atmosphere, I think, for trying to, as we like to say, move the needles. In other words, make a difference in the overall health of our community, decreasing heart disease, decreasing obesity, increasing physical activity, and increasing nutrition. We do a lot of communicable disease tracking and looking, you remember a few years ago when we had the H1N1, we wrapped ourselves around that and tackled it. And I really do feel like the reason that we did not have that flu was not as bad as it was the job that public health did in getting out and encouraging and providing those flu shots to as many people as possible.
You touched on something that very few people may not realize, that how closely you do work with our schools. And our public health and our school health, they oftentimes can be separate entities or animals. But here in this county, there's a real effort to try to work with our schools, school nurses, and the programs that we offer here. We try.
We have our school health partnership that we're working with Williamson County Schools and Franklin Special School District. We have a nurse who focuses a lot of her time on working with the other school nurses. Sometimes the school nurses are out there and they're kind of in a vacuum. I mean, they're there, but they may not necessarily have someone who is knowledgeable about immunizations, or may not have someone who's as knowledgeable about communicable disease. And so she serves as a resource for them. So if they have a question about any of those subjects, they can shoot her an email and she'll get back to them. We work very closely with all the school nurses in trying to assure that all children have a medical home. It is so important for children to have a provider where they can go who's looking after that child, not just somebody to go to when they're sick. Somebody who can take care of them and do a physical every year to make sure that they're growing appropriately and developing like they should. So we partner with them and go through all the forms that they have to make sure that, if a child doesn't have a medical home, that we contact that parent and make sure that they know what resources are available in Williamson County.
Well, preventative is the answer. Now, oftentimes that doesn't occur, but if we can educate, we've seen that in so many different areas of our walks of life. But in your efforts and in the state's efforts, preventative and addressing those early on does eliminate a lot of the cost and the programs associated. Becky, we've got about 2 minutes left to go here on our program, and I'm sure, as always, I overlook something that you would like to say. I know you have the greatest employees in the world. Most every director and elected official or appointed official feels that way. But is there something you would like to say in the last couple of minutes that maybe I've overlooked, that you need to get the message out?
This is going to be a personal message. I just feel so fortunate and so blessed to live in this community. I've worked with a lot of communities in different parts of the state, and Williamson County is unique. The departments, the cities, all work together so well to make this a wonderful place to live, and I'm just so happy that when we moved, I drove through this area and saw that this is where I wanted to be, and just have that just real, and I'm just very, very proud to be a resident of Williamson County and be able and feel fortunate to have worked with all the great people in Williamson County government.
And you've done a great job.
Thank you.
Heading up our public health. I'd be remiss to say we will miss you. We know that you're leaving. This will be your last time of being on our television show to talk about it, but I'm also confident that there will be someone following your footsteps that will keep the great things you've got going, have those continue on. So best of luck of you in your new development and your research and your kind of going back a period of time in your life where you started from, doing some. Thank you for what you do. I'm Rogers Anderson, Williamson County's mayor. We've been having a conversation with Becky Brumley, a director of our public health here in Williamson County. Have a good day.